Hello, I'm Robert, and great to see the first vaccination in Latin America for the Pfizer vaccine. And we should hopefully start to see more and more of these stories. There were several firsts in Latin America, and it was in Mexico, Chile and Costa Rica. And the very first of all those was in Mexico. And so there's the actual video you can watch of this happening. And that's the Pfizer vaccine being brought to Mexico. The Pfizer vaccine is a completely new kind of vaccine, so is Moderna, and as a result, only the people who invented and made that vaccine, they're the only ones who could make it yet. They've decided to ramp up on production of their vaccine, and they think that's a faster way to supply vaccine to the world than to try to teach everyone else in the world how to make it, because it's so modern and difficult to make. And now this situation is really, we can expect a high level of vaccine coverage in Latin America. This, for instance, is Mexico, and they've been very quickly. We hope to get this over the entire world. Some areas it's quite difficult to get vaccines, get full coverage of vaccine. This, for instance, is Mexico, and as you can see, they have a very high level of vaccine coverage, and so we can expect Mexico, as soon as it starts to have lots of vaccines available, to be able to ramp them out. And it's the same for Brazil. It's the same generally in Latin America. They have a reputation for being good at vaccination. And so the World Health Organization has been saying. This is Brazil. They have developed, they have built a new vaccine-making factory just for, they're in the process of building it. This is an artist's impression, obviously. You can see all the trees look almost identical and things. But this is the factory that they expect to be open in early 2021 to make the AstraZeneca vaccine for Brazil. Brazil were one of the early trials, and they have an arrangement with AstraZeneca. They can make the vaccine themselves. Indeed, AstraZeneca is zero profit. They pledged, that was a condition of the Oxford University. They would not want to license it to anyone who was going to make a profit on it. And they went to all the big top vaccine manufacturers. Only AstraZeneca were willing to make it under those conditions. And their books are going to be audited and everything to make sure they make no profit. So AstraZeneca is not going to earn anything out of this, except of course its reputation and lots of good side effects, but not directly. It's not going to earn anything from this vaccine. And they're licensing it around the world so that lots of generic manufacturers can make the AstraZeneca vaccine, which is the lowest priced one so far, just a few dollars. And this has passed phase 3. This was actually, AstraZeneca was the first to get a peer-reviewed publication of their phase 3 results. That was just a few days ago. And so expect them to be approved pretty soon, as after the World Health Organization expect to be approving them early January, several vaccines. And so we've got the Pfizer and Moderna, just the first. They've got lots more on their way, and AstraZeneca it's got very good data. It's definitely going to be approved. There's no doubt it's going to have an emergency use authorization. It'll be mainly just the details of what the requirements are going to be, like which groups of people should be vaccinated and so on. That's the only thing to be settled with AstraZeneca, and they vast numbers. And the World Health Organization pre-ordered 2 billion doses now. The funding came through in the end of countries supporting them, plus Canada's going to give some of their excess vaccines, and the whole world has pre-ordered, I think, enough for 3 billion people, I think. So 1 billion for with COVAX, but there's going to be loads and loads of spare vaccines, assuming that nearly all the phase 3 ones, or all of them, pass, as seems likely. And the world is going to be awash with vaccines as we go through into 2021. It's looking really, really promising for vaccines. And nobody expected them to be so good. 95%, that's really far, far higher than anyone's hopes. That was for Pfizer. Moderna is similar. The AstraZeneca one, if you start with half dose and then a full dose, quite surprisingly, so using less of the vaccine, and they will find ways of optimizing them. It's even possible that the Pfizer one only needs one dose. We have to, if it's carefully done, we have to research into that. We can't just say, okay, we'll just use one dose because the data looks so good. We have to do proper trials, but it does look good. It may be even possible to get down to single doses for some of these quite soon. That again was unexpected, and it's looking really, really good. Look, this is why we just possibly might have a single dose for Pfizer. Look, this was the first dose. First dose there, within 7 days, just levels off like that. And the second dose is sometime around then. They can't actually authorize it for just a single dose because the trial was for 2 doses. I think they need to look at the data, maybe do some other trials. There's a possibility that a single dose is decided that the single dose of the Pfizer one is actually giving you significant protection if you choose the dose correctly. And then they can maybe reduce the dose sometimes and get less reactions. It's already lower than their highest dose that they had in the phase 2. So lots of these vaccines going to develop. And there's some wonderful ones coming on. There's Medicago, which I think is that the name, something like that, rather strange name. But this is a vaccine that is produced in plants instead of in hen's eggs or in cell lines like these ones that are produced in. This is actually produced in plants. You grow, it's a very variety of tobacco, I think, and they grow and they use that, and it produces lots and lots of these little spikes, of the protein spikes that are the same protein spikes as SARS-CoV-2. Obviously they don't do anything in tobacco plants, whatever the plants are that they're using, but then they harvest them and they can inject them, just the spike, pretty much the spikes directly. And so lots of really interesting ones coming along, and some of them will be low cost and easy to make, and it's sparking lots of unconventional new ideas of vaccines, but ones that are thought to be likely to be very effective, and like the Pfizer and the Moderna, very safe the way it's designed. These vaccines are very, very, very safe. So it's an emergency use authorization. Yes, I talk a little bit about that down here. Those are the side effects and that they've noticed so far, usually mild, and it's basically when a vaccine, nearly all the vaccines, even AstraZeneca too, it's an adenovirus that is actually a DNA virus that goes into your cells and it stimulates, it injects a little bit of material into the nucleus of your cell. It's not an RNA virus. And so it's not, they're using a DNA virus in order to, it injects into the cells of the nucleus, and it uses its DNA to produce messenger RNA, which then produces those spikes. And from then on, it's very much like the Pfizer Moderna one. That's how AstraZeneca works. It's not surprising it has a rather similar effect. It's basically producing lots of spikes, just like those do, even though it's a modified adenovirus. I just looked that up recently and found out. That's how it works. It's actually a DNA virus that creates the RNA spikes, that creates RNA messenger, and then those create the spikes of the protein. Spikes can't reproduce because they're just protein. They've got no instructions. And then soon the whole thing is all gone from your body because the adenovirus can't reproduce either. They design it around an adenovirus that can't reproduce in humans. And so it's soon all gone, and then you've got so what happens, whatever it is they're injecting you with, it's something that your body recognizes as being foreign. It doesn't know what it is. It sees all these spikes in the bloodstream, and it says, ooh, spikes, what are those? They're not big spikes, they're just these little spikes. It doesn't mean something that's damaging. Things like that are used in a natural way in your body in order to go in and out of cells. And but these spikes trigger your body into thinking that it's something natural and genuine in order to get into the body, into the cell, and then replicate. And so your body has all these, suddenly your body sees all these spikes, but they're not familiar, they look a little bit strange, and so it starts attacking them. But it doesn't know what they are, it doesn't recognize them. And so you just get a general purpose, swelling, redness, a bit of inflammation. You might get a headache, you might get muscle ache, feeling tired, you might get a fever, but just for a day or two, this is your initial reaction to all the spikes. or whatever it is that's in your body, little fragments of protein, and your body says, oh, that doesn't look quite right. Let's generate a fever. That generally helps when you're being infected by something. So that's basically what happens when you're injected. And then your body kind of relaxes back and says, oh, it hasn't done so much as it seemed it was going to do, because the spike's just wandering around. And then your body will start, so you don't have a fever going on and on and on like you would with flu. And then your body starts learning, what is this intruder? Let's have a little bit closer look at it. What's it doing? What's it look like? And then it becomes much more intelligent. It learns how to fight the spike. It doesn't know the spike isn't doing anything. It doesn't know it's totally harmless. So it looks at, oh, lots of spikes in the body. What are these things doing? Lots of protein spikes. You must get rid of that because it doesn't look right. It doesn't look like the body. And then they start creating these antibodies. And the antibodies will latch onto different sites, different parts of the protein. And they latch onto bits of them that in such a way that it no longer functions, because it's extremely complicated to get into a cell. And these spikes have to do all sorts of different stuff to get into a cell. And basically they're signaling, they're saying to the cell, look, I'm friendly, I'm nice, let me in. And then the cell looks and says, yes, you look like what we've been waiting for. Come in, here's our taxi. And they make a little taxi, almost like the cell constructs a little taxi and puts the virus into it and takes it in and says, here you are, chauffeurs it in. And says, here you are, here's the inside of the cell, you belong here, do what you like. And out it goes and it makes copies of itself. That's basically how a virus works. And so and then the antibodies, and they go around, they find these spikes, and they go and say, oh, this spike doesn't look right, this can't be right, but it looks like it's doing something strange, let's just block it. And they stick onto little bits onto the spikes. And with these bits of antibody blocked by the antibodies blocking the spike, then the spike can't get into the cell anymore because it's covered in antibodies. And when it comes up to the cell says, that's a strange thing, I'm not going to let that in, it doesn't look like anything we're expecting, and it can't get into the cell anymore. So that basically is how antibodies work. And then you have the T cells which go around and they look and they recognize things and they attack them. I don't know about these things. I'm just a good communicator. I know how to read a scientific paper, and I'm just explaining what the scientific papers say. And so I don't research into anything like this. I've just been trained as a mathematician and I'm a science blogger, but I know how to read papers and I know how to explain these things in somewhat easier to understand terms than the long, complicated, highfalutin language that they use in these papers, which I'm sure probably 9/10 of my audience wouldn't be able to make head or tail of. And so anyway, so that's what happens. That's why you get these side effects right away, and then it takes about 7 days, and that's what's happening here at the beginning of this. You have these 7 days. So back here you have the information right at day 0, and then the information goes away. For most people, it goes away very quickly. Hours the next day, your fever is over if you have one, or the day after it be gone. But then your body is still trying to, what is this intruder? What should I do about it? And then by day 7, it's managed to make all the T cells and the killer T cells and the antibodies and things. I'm not quite sure which comes first. I think it's the antibodies. But anyway, experts will say, but then it just goes like that, and off it goes. And these, so just to explain, these are the natural infections, and they're just increasing. And this is a placebo group, and then this is in the vaccinated group, and the infections were going the same rate as the placebo group. After 7 days, the vaccines just level off and hardly any more left. It's not total protection. 1 in 20 of that happens down here in the vaccinated group. So it's important to realise physical distancing is much more effective than a vaccine if you can do it totally for this particular virus. If you can do physical distancing, that's as good as a vaccine, better than a vaccine. With a vaccine, you still have a small risk. If you're vaccinated, do continue to do the physical distancing as well. Don't stop because you've been vaccinated. I'm just going to explain about the emergency use authorization. So some governments have not been very clear about this, but What we have is an emergency use authorization. We don't have full authorization yet. This is done on a risk-benefit basis, that you vaccinate people who are at risk of getting COVID-19. You balance the risk of the COVID-19 against the benefit of stopping them getting COVID-19 against the risk of the vaccine. And that's how you do emergency use authorization, and why you can do it before you've got full authorization. However, in this particular case, then the vaccines seem to be extremely safe. And so it goes way beyond what you'd expect for normal emergency use authorization. The reason is we're going to have very huge trials of tens of thousands of people in multiple countries, multiple ethnic groups, multiple age groups, and then the ones that they haven't tested on, then they're not vaccinating those people, like the young children and pregnant women. They just haven't tested them. It doesn't mean they don't work for those people, but they just haven't tested them yet. So not only do we have tens of thousands of people in the phase 3 trials, and we have 6 months of data from phase 1, we also have these 13 or whatever the latest number is, vaccine candidates all in phase 3, all producing these spikes. Most of them producing these spikes. Some of the inactivated total virus, there's several of those from China, but most are using these protein spikes. And so they're all basically, the main concern is, apart from allergies and short-term effects, for long-term effects, the main concern is that inoculating you against the spike, by injecting you with the spike, the main concern is that your body might learn to fight the spike, and it might be similar to something else in your body that is needed for how your body functions. In other words, kind of autoimmune response, because the spike happens to resemble something else in your body, so the antibodies stop something else in your body from functioning so well. That's the main concern. And if, for instance, the natural disease did that, and the antibodies to the natural disease did that, then of course there's a possibility that the antibodies of the vaccine will also do that. So we're not talking about something that doesn't happen with natural disease. We're talking about something that could happen with natural disease and also happen with a vaccine. And the vaccine is much safer than natural disease, because you are just presenting this particular spike. You can decide what you're going to present to the immune system. And then you look at what the antibodies to that do. They've looked very carefully at the antibodies what they call them, I forget the name, not antigen, the things antigens bind to, I forget the name of it, but there's a name for those sites on your protein, and they've looked at all those sites, and they've looked at the other things in your body and see if there's anything that resembles them enough so there could be a problem. There doesn't seem to be. And then they looked at the actual data, and they're not seeing, and so we've now got all 6 months data for many of the vaccines. They're all using the same method. They're not seeing this. And then for the phase 1, and then cases in different groups as well, we've got 2 months data from all the phase 3 trials. We have 3 of them already, and I think together it's about 100,000 people have been vaccinated. No, 100,000, about 50,000 vaccinated, 100,000 people in total. I think it's 50,000 vaccinated in total, more than that, are vaccinated in just the Pfizer, Moderna, AstraZeneca trials. In fact, it might be more than that. There's a huge number in the AstraZeneca trials. And we are not seeing any serious results of this sort of effect in any of those. So they do look like very, very safe vaccines. And so admittedly, we've only got 2 months data so far for the phase 3, but we've got so much of that 2 months data from so many different trials that it really does look very, very safe vaccines. And then all the other ones, the other 11 or however many it is now in phase 3, then they are all vaccinating tens of thousands of people too. And they have not had to stop for any severe. They've had to stop, as there always happens with vaccine trials. If someone dies, then you've got to stop and find out, did they die? And for instance, a couple have died, one with COVID, who was in the placebo group. It's kind of very sad. You think about this person who went to the trial and he got 2 injections of a saline solution and then he died of COVID. But, I mean, did he die of COVID? Oh dear, I should stop and check that. Let me just check a minute. I'll pause this and then check if he did die of COVID. I can't find my source just now as to that. I found a page with actually his name and a bit of obituary about him, but I can't find it just now. But there was he actually, yes, he did. He died. He got 2 meningitis jabs, which is the placebo for the AstraZeneca trial, and he died of COVID. And so, yes, that's I tend to forget, but they're part of the heroes in all this. Are these volunteers who take the trials. And I think it's so sad that it's something that I really wish the world had done. The World Health Organization, they designed a way of doing vaccine trials to hugely reduce the risk of people dying in vaccine trials. What they did was they were going to do a multi-vaccine trial, so we've got 13 vaccines in phase 3. They would have all been in the same big trial, and then there would have been one placebo group. And all those vaccines would have been tested in all the countries around the world. Everyone would randomly get one of the who wants to be in a trial anywhere in the world would randomly get one of the 13 vaccines or a placebo. That would reduce your risk of dying like this of a placebo to 1 in 14. It would also permit direct comparison of each vaccine with the others in all the age groups. So you would be able to say, oh, this one is better, this vaccine is better for this age group, this is better for that, this is better for pregnant women if you test them, this is better for elderly people. If one vaccine is better in one ethnic group, you'd say this vaccine works a little bit better for people for that in Latin America or something. But it's not likely that would happen. Actually, that's people are very skeptical that would happen. But you do get some differences, like sickle cell anemia. You do get some differences between different ethnicities. But it's exceedingly unlikely. But you would have been able to have had a direct comparison, and just so sad that never happened. It's not very easy to persuade vaccine manufacturers to do such direct head-to-head comparison with other vaccines in the same trial. And it's just I think it's so sad that this never happened. And I hope maybe now we've got some vaccines, that they start to do these proper vaccine trials of multi-vaccines all at once to greatly reduce the risk of something like this happening to about 1/10 of the current risk to volunteers in the vaccine trials. Anyway, so that's, or even less, depending how many vaccines you have, and give much better, more granular data about how you can especially allow the people to recommend which vaccines are best for which situations. It was a brilliant scheme, and I don't know if it's going to come to anything. I don't think there are any in that big multi-vaccine trial yet. Hopefully there will be at some point. Anyway, so that's that. And I think we're going to stop quite soon. Anything else I want to talk about? You all know that. This is a thing that I did just to try. I come across people all the time who are saying, there's no risk, it's just like flu. But I mean, once they get people close to them, they'll start to realise. Once it spreads more, and hopefully it would be best if it never happens. And there's Dr. Tedros wishing us all a safe. Let's just play him and then I'll stop.
I'm speaking to you on the eve of a holiday season unlike any other we have known. As 2020 draws to an end, a pandemic of historic proportions is preventing many of us from celebrating in the ways we would like. As tight-knit communities and around fireplaces and dining tables, sharing stories, love and kindness with those dearest to us. Instead, hundreds of millions of people are today making grave, heart-wrenching sacrifices by staying apart to stay safe. But in doing so, we are giving the most precious gifts, the gifts of life and health. In all beliefs, cultures, and communities, life and health are paramount. All around the world, throughout this most trying of years, we have seen over and over again the sacrifices of so many people to protect and preserve life. Health workers, carers, and other essential workers have made great sacrifices to save lives and prevent suffering. We must not squander their sacrifices, nor those made by so many families who, this holiday season, will sit at family tables missing a familiar face. Despite so much loss, we have built so much hope. Unprecedented partnerships have been forged, showing that obstacles can be overcome if we prioritize what's most important. Vaccines are offering the world a way out of this tragedy. But it will take time for the whole world to be vaccinated. That means we must keep striving together as one family to meet the challenges we still face. We must continue taking comfort in the fact that by caring for others through acts of solidarity and safety, we can share the greatest gift of all, the gift of life. Happy holiday season.
So, there we go. We can all share that greatest gift of all, the gift of life and health.